Well, welcome. What I'd like to do is share and compare and contrast some of the technologies that are around this room and also that we've used in our office, and answer questions. If anyone has any questions, feel free. I certainly will go through our slide presentation and just sort of compare and tell you why. And then also Marty is going to show and share some of the techniques and why we feel this technology is superb. And really, I think at this point, for non-invasive improvement of cellulite, for improvement of tightening skin, for improvement of fat reduction has been ideal in our practice. Marty and I were just sharing that if you look at happiness in terms of procedures, that this is really a happy procedure. In Marty's practice in Dallas and our practice in Beverly Hills, we've not had any unhappy patients. We've not had anybody say, I want their money back. I haven't had anybody who was at all unhappy. So I think it sort of speaks for itself right there. And do you agree, Marty?
I have not had a single patient who didn't relish coming back to have their next treatment. It's that good.
Yeah. Among all the procedures that we do in our office, this may be our #1 procedure right now. We have more action going on with this than anything else. And a lot of it is around cellulite. Some of it, of course, is around skin tightening. We've had radiofrequency skin tightening for a long time, but this technology is better in that it's less painful, it's easier. Well, let's go through a few slides, and certainly if you have any questions, feel free to ask. So this is really the third generation radiofrequency device. People have heard of the first generation, which was a unipolar, a monopolar device. It was called Thermage. It was the first one that existed. And it had problems. We had cases of subcutaneous fat atrophy. We had cases, really a lot of people really were complaining about the severe pain. Finally, the company learned how to turn it down a bit, and it became a better technology. We don't use it at all anymore in our office. And then the second generation is really one that was a bipolar unit. And a bipolar radiofrequency device also had a little bit more pain, had a very small tip, did not allow us to treat large areas the way Marty's doing now. And so it was good for facial work, it was good for neck work, maybe it was good for the eye work, but certainly not the total body that Marty's showing. And you have had experience with some of the other devices, Marty?
Yes, I think I've used all of them. And, just like everything else, your cars get better, technology moves forward, and this is just the newest technology. You had mentioned that it was less painful. This procedure is not painful at all.
Yeah,
it's actually very comfortable.
Yeah, it's probably just a feeling of warmth. And is that what you're feeling right there?
Yes, just light warmth.
Yeah, I know. My wife has gone through this treatment, and she says it's really comfortable. She can fall asleep because it just feels like warmth. So there's a number of reasons to use this type of technology. Not only does it tighten skin, which might be the biggest indication we have in terms of tightening along the neck and the jowls. Maybe the second biggest indication is cellulite. And maybe the third indication is fat reduction. Do you agree with that, or do you have a different?
Fat reduction is thermally done because it metabolizes the top layer of fat. And we use it post-liposuction for that exact reason. If you have cannula marks and things of that nature, it will metabolize that fat and clear that up. So, yes, we found post-liposuction, it's a godsend for doctors who have to use anything for lymphatic drainage.
Yeah.
So,
it evens things out. And scientifically, most people can tolerate up to about 42 degrees. As you get past 43, up to 43, you get more fat reduction, but you also have a little bit more feeling of heat. Is that what you feel?
You feel more heat in the abdomen and on the face. Like her thigh, at 45, she'll be completely comfortable. Some parts of the body are a little bit more sensitive than others.
Yeah.
Abdomen and face are a little bit more sensitive. Your legs and arms are not very sensitive at all.
Yeah.
So for cellulite on the legs, I try to get them to 45.
Yeah. Now, if you look at the way, why is this more comfortable? And part of it is this tripolar technology. It really makes the heat more superficial. It's not as deep. It is one of the differences when you're looking at bipolar and monopolar, where the heat went deeper, and I think that caused some of the extra pain. Now, there's a number of other uses that we actually use it a lot for. One of the first peer review article that you might look at is acne. There's been a few papers on using radiofrequency for acne, and I think the way it works is that it's really causing, not only is it causing skin tightening, but it causes some shrinkage of the oil glands or the sebaceous glands. And so we've had good improvement with the acne. And because it's much more comfortable than the first generation radio frequency devices, it really, for teenagers and kids who have acne, it allows it to really, they tolerate it very well. Have you guys used it for acne?
Absolutely. It works great on acne, and it works great on acne on adults also.
Yeah.
And you're correct. It's just drying up those sebaceous glands to a point where they're not nearly as active.
Yeah.
Very happy patients.
If you look at some of these other peer-reviewed articles, there's peer-reviewed articles on arm reduction, on circumferential arm reduction. There's articles on cellulite, as Marty's showing right here, although I don't think she has much cellulite, so there's not much to correct here. But if, it does really work on cellulite. If we had somebody who had real cellulite, we would see that.
Now, understanding how cellulite works and getting the skin up to temperature, we can look on our monitor here. Even after I've stopped treating her, she's still at 42.7. And I'm sure anybody can ask her. She's as comfortable as she can possibly be. This is like a hot stone massage. You get her up to 45, or your patient up to 45, they will have no pain, and they will have a significant reduction. I use it on my wife, and she's starting to bother me because summer's coming and she's got to wear a bathing suit, so I understand.
Can you explain how you use this thermoscan and how it helps both the patients and you as the operator?
Absolutely. This machine is actually showing me my entire treatment area. It's giving me the hottest point, that's what this mark is, but we can tell from this, my treatment area from here down to here is completely being treated at the same temperature. I'm treating the entire area, and you can see it visually. Now, the patient's laying down on her stomach right now, but normally when they're watching this, the patient can see and understands the whole procedure being done because they can see it.
Yeah.
And when you can see something, you can believe in it. And it just really makes for a smooth 30 minutes because they're watching the whole thing and enjoying it.
Yeah, I think it's been much easier for people to see that the results are going on. And the other thing that we do, I know our nurses and physician assistants to do this, is that often when you're treating half a face or half a neck, you see the improvement right away. And so it's sort of an immediate thing. Do you do that with your patients too?
We used to do it all the time, showing them before and afters and side by sides, but the word of mouth got out so fast we didn't have to do it anymore. People just come in and just, like I said, they really enjoy it. It's a spa treatment that actually works, and just great.
But when you do one side of the face, you see that people can see a difference right away on the one side, and then you do the other side, or is that another building, sort of practice builder, or you don't do that?
It's a practice builder. When we first started, yes, we showed them both sides, but we became so busy with it.
You don't want to waste time.
We didn't have the time.
Okay. And among the other articles, I think you can see not only has it been used then for cellulite, for acne, and even for spot fat reduction. I think it works well there. As Marty says, you got to get up to a certain temperature, a requisite temperature. So some of the key benefits, we would say that everybody would agree: it's pleasant, it's easy, it's non-invasive. It's not like laser lipolysis, where really we're talking about something that's equivalent to tumescent liposuction. There's been no complications. I think we both shared that our patients are uniformly happy. We have not had any complications, as there have been with other radio frequency devices. Have you had any complications, Marty?
I've had not a single complication. In order to have a complication with this machine, you would have to stop moving it, and the patient would become very uncomfortable and not allow you to hurt them.
Yeah.
So it has its own built-in safety mechanism. The patient says, ouch, you simply lift up the handle.
Right.
The energy is no longer delivered, so you don't have any issue.
It really is idiot-proof. I think it would be almost impossible, right?
I think it is impossible.
Yeah. And so your settings right now, Marty, are what?
Right now I've got it at a warm-up setting. I'm using 65% of the machine's power, so just slightly over half. And even after we stop treating her, you see she's still at 40 degrees. And if you watch, it'll take some length of time. The body is a great heat soak. And
so you feel warmth. If you put your hand there, that's warm right there.
Absolutely. Put your finger on it.
Yeah. So
and then look, you can see where
you can see it. Yeah, exactly.
This whole treatment area, as you can see by my colors here, is still at 37 or 39.7 degrees.
Yeah.
And it literally would take me about 15 seconds to get it right back up to 40.
It's really uniform. I don't think you can get that uniform heat distribution with the other devices, with the first and second generation devices.
The first generation devices were very small heads, so you have a lot of energy in a very small area. And the reason it caused necrosis problems and things like that is it had to go to a ground.
Right.
The bipolar and much more specifically the tripolar have eliminated that grounding issue.
Right.
So we're delivering power over this surface instead of over a surface this big.
Yeah. And the other problem from a doctor's standpoint, from the business standpoint, is those consumables are really expensive. And I don't remember how much we spent, but we were spending a lot of money with that first generation consumable devices, whereas here the consumables are really nothing. Oh, it's this.
There's
okay.
Our consumables.
Yeah, there's the glycerin thing.
$4 for 40 treatments.
$4, okay. That anybody could afford. And then finally, it's good for all skin colors. We use it, certainly, we have a lot of Asian patients, a lot of dark skin patients in Los Angeles, so it works well in all skin types. We've used it in African Americans, and you probably have done all skin types also.
It is colorblind. It does not know what color it's working. And so, yeah, that's one of the wonderful things about it. I also find it works really great on stretch marks, too.
And then in terms of the actual heads, there's a smaller head that we use for facial areas that Marty has right there. And you might use this, for example, in the infraorbital area.
Yeah, and in the nasolabial fold.
And then you use this at neck areas and cheeks. And then this obviously is the body one.
You got it.
Okay. Do you agree with the slide then? You actually go higher then. You may not agree with that slide of 42 to 44 degrees for the body. You go higher than that even?
For cellulite.
For cellulite, yeah.
Only for cellulite do I go to 45. Otherwise, that screen is exactly correct.
Okay. And, it is FDA approved. It is very safe. I think it's one of the safest devices that we do, compared to all the other things that we do in an aesthetic office. Do you think that there is any patients that it wouldn't work on? I see here they have, pregnancy. Let's see. We use it a lot in post-pregnancy. We use it for love handles. We use it for sagging skin. Maybe the double chin area is a good area. Around the eyes, certainly. Are there other areas that you guys use it for?
Basically, your epidermis is your epidermis.
Yeah.
This machine will work on any portion of your body. Hands are another place that women like a lot.
Yeah.
The bat wings or the arms, bingo arms, depending on where you live. That's a really big thing for.
So right in this area, right under it,
the tricep area.
And the hands, just by the tightening it gives an appearance, even without putting fillers in there. Just putting the
is a significant improvement.
Yeah, I agree. In terms of the published studies, there's a lot of work, and it's sort of hard, and there's not a great way to measure cellulite. But this was an excellent study that I think proved that cellulite, it works well for cellulite, and maybe it works as well as some of the internal laser lipolysis studies. It's certainly heating the skin as well, and cellulite, as Marty talked about, is a combination of things. Certainly tightening the skin will improve cellulite. Sometimes these septae of the fat need to be broken up, and some of these massaging devices. How do you break up the septae, do you think, with this device? Or is it just the skin tightening?
I think the skin tightening and the heat and the lymphatic drainage of the area all combined really make for the smoothing effect.
Yeah. The results, I think, are the maintenance treatments are necessary. I think it works as long-term as other treatments. What do you tell your patients about maintenance and how often they need to do this?
I tell them that about every 6 months come in for a single treatment.
How many treatments do you usually advise does it take to get a good result?
On cellulite, 8 treatments.
8 treatments, yeah. That's about our experience too. Certainly more than 5 or 6.
Yes.
Some people respond better, and certainly at her age it'd be easy, but an older person takes more.
I had a lady who hadn't wore a pair of shorts in 9 years because of cellulite. Come in. We took care of her legs. Her cellulite was reduced to the point that her husband noticed, which is really saying something because he didn't know she was having the treatments.
Wow.
And she wears shorts now.
That's impressive when a husband notices.
That's what I'm saying. It's really impressive.
But you noticed your wife's because you did the treatment, so that was okay.
My wife insisted.
Yeah. And we did talk about the other causes of cellulite, which we don't influence, which include diet and heredity. Obviously, lifestyle factors and clothing. We're really affecting one thing, which is tightening the skin and maybe breaking up some of the septae and maybe some isolated fat reduction. And here we can show you some pictures of long-term results of cellulite reduction. And I think you can see that you can get some very dramatic improvement. This is only after 3 treatments, so this is even less than what our experience has been either in Beverly Hills or Dallas. Here you can see again some really good gluteal improvement, and this is a tough area to get improved just with liposuction or laser lipolysis. In fact, we often stay away from that area.
Yeah, the curve makes it almost impossible with lipo.
Yeah, and then I think it works well in the arms. These are some of our arm results, and I think you get both tightening and some fat reduction. So I think overall you can see that it is a very good treatment for cellulite, a very good treatment for skin tightening. It's easy tolerated by patients. The results are immediate. It's non-invasive. It's really where a lot of patients want to be. They don't really want to have an invasive procedure. The side effects have been negligible or not really non-existent. I shouldn't even say negligible. And it's effective for all skin colors. Do you have anything else to add, Marty?
Another nice thing for doctors with multiple practices, the machine has a very small footprint and it's very portable.
Yeah.
So we started with 2 offices and 1 machine, and now we have 3 machines and 2 offices. But it was very easy to move back and forth until it became overwhelmed.
Yeah, so that shows that this machine is working constantly in your office.
I did an average before I came here. It runs an average of 5 hours a day, all 3 machines.
Wow, and you guys are a plastic surgery, cosmetic surgery?
We're a cosmetic surgery out of Dallas.
Yeah.
It's fantastic.
And we're a dermatology practice, and we keep ours running constantly too. So it really is the most used machine among everything that we have. And we have about 20 lasers, and you guys probably have a lot of other...
Yeah, we have a boneyard of lasers.
Yeah. A cemetery of lasers. So, in summary, well, thank you very much. Do you have anything else to add as the patient?
I'm just extremely comfortable.
Oh, it seems really comfortable. She's
trying to stay awake.
Yeah, so in summary, I think it's something that we would advise people to get if they're looking for new technology. It works really well. There's nothing better in terms of treatment for cellulite that's non-invasive, and I think it compares favorably to anything else that you can find around here.
Yeah.
Thanks, Marty.